is news for all America.
All right, good morning. Thank you so much for sticking with us for NBC 23 News Today. Today we're going to talk about a pretty important tool that's going to help Valley surgeons. But first, I'm going to go ahead and let you introduce yourself and tell us who you're with.
Okay. My name is Reynaldo Morales. I'm a general surgeon here in the Valley area, and I'm with Mid-Valley Surgeons.
All right. So, Dr. Morales, kind of talk about Da Vinci.
So the Da Vinci robot is actually something very important to me that I use in the majority of my practice. So regular laparoscopy is a tool that's been available essentially since the 90s. And the Da Vinci robot is just kind of another tool that adds on to that.
Okay.
Allows us to perform more complex surgeries and have better outcomes with less pain.
Okay, and pretty much how does it work? Does it pick up on certain things, or do you have to like navigate it yourself? How does it work?
So essentially when you're using the robot, you set it up like you would a laparoscopic case, small incisions, ports. We put these instruments in, and then there's an actual console that we sit at to control each individual instrument. So it's essentially like the robot is giving you 4 arms instead of 2.
Wow, more arms the better.
Yeah, exactly.
And with results, are you able to share them with your patients, and it kind of gives them like a view of like, oh, okay, so this is more what's going on? Is it more interactive like that?
Well, it's more interactive in the sense that, you know, there's video that we can record during the cases, pictures that we can share with them, and talk a little bit about the process of how this is different and potentially with less pain and better outcomes overall. So patients enjoy that part as well.
Very nice. Now, is this new here to the Valley? Something that's being introduced?
This is. So the Da Vinci robot here at Knapp Medical Center, we got about a month ago.
Okay.
And so we've started using it over the last 2 to 3 weeks. And I mean, we're definitely getting a lot of usage out of it and seeing good results.
Absolutely. So yeah, this is just furthering, well, to show you how technology continues to advance.
Exactly.
And it helps you all.
Definitely, definitely. It helps us, it helps the patients, and so it's a win-win overall.
Absolutely. And about how many surgeons do you have with your department? Or is it just you? What's the team looking like?
So there's 4 of us.
Okay.
There's myself, Dr. Reyes, Dr. Garza, and Dr. Farias.
Okay. And is the training on this is like pretty extensive, or was it like pretty much a breeze? How was it like for you?
So it's because it's an extension of laparoscopy, the actual training portion for it is shorter. It's maybe over the course of a couple months. And then you have several proctored cases where an experienced robotic surgeon is with you. Okay. And then after that, you start doing cases independently.
Now, do you see more of technology like this coming into, I guess, the medical field, or what would you say about that?
Yeah, definitely. I think that there's always room for innovation and for new technology that can provide better outcomes. And so I think this is just one example of that, and it should continue to grow in the future.
Absolutely. All right. So yeah, this is already in y'all's offices. This is already something that y'all are using already?
Definitely. Right now it's at Knapp Medical Center, and so we do our cases over there, and it's accessible to both, you know, elective patients as well as any patient that comes in through the emergency room and needs surgery.
Absolutely. All right. Well, let's say somebody's watching this and they want more information about it, or they want to learn more about it, and maybe they might need it. Where can they go, or how can they contact you?
Yeah, so Mid-Valley Surgeons has an office here locally in Weslaco. Okay. And you can always call to make an appointment. We also have a website. So definitely any interest, you know, feel free to reach out to us or through your primary care doctor.
All right, this is very cool. So Dr. Morales, thank you so much for joining us this morning and talking about the Da Vinci robot. It sounds like it's going to be very helpful for you guys, so it's going to be very beneficial. So thank you so much for joining us.
Definitely, thank you for having me.
All right.